Hi, I'm Joe Chili. Mornings 7 to 9 at Buffalo's oldie station, the Big Wack. Joining us on the Big Wack's Buffalo on the Rise today from Western New York Pain Relief, Dr. Christian Miliotto. How you doing?
I'm great. How are you?
Yeah, I'm doing very well. You know, thanks to you, actually. Let's talk about a couple of things that I want to mention right off the bat. Is, you know, the buzzword people are talking about all the time, and I hear it all the time, is neuropathy. But I'm not really sure what neuropathy is, and maybe, you know, our viewers don't know what it is either. Can you give us kind of a layman's explanation?
Yeah, so it's symptoms that people are feeling that are related to their hands, legs, or feet. They're noticing some weakness or heaviness, balance issues, numbness, burning, tingling, pins and needles, or creepy crawly type feelings. And it's a sign that there could be damage occurring to the nerve, which could be coming from diabetes, people that have had chemo or radiation therapy, circulation issues, or people that have problems with nerves related to their neck or back.
When people age, do they normally get some kind of neuropathy?
Yes and no. You know, so people don't know they have a problem until it hits them. A lot of times spinal stenosis is one of those things that happens older in age, but not everybody gets neuropathy. Neuropathy and symptoms related to the neck, back, or joints in our body, our shoulders, hips, and knees, these are things that do build up over time, and it really does have to do with that person's lifestyle, things they've been through as they've aged, and then the level of inflammation that built up in that tissue to cause the symptoms they're having. You
know, you mentioned diabetes. Is that something that constantly, you know, or regularly causes neuropathy?
Diabetes is one of the #1 causes of peripheral neuropathy, but there are a large majority of people who are not diabetics who have developed neuropathy over the last 30 years as we've learned what neuropathy actually is. And that's where medicine has realized that it's not just related to diabetes. You could have a major issue with your neck or back even without pain. Okay, it's affecting the nerves and the discs in your spine. You could have a problem with circulation. As we get older, we all have problems with circulation. If you're noticing that your hands and feet are a little colder than usual, that's a big sign that natural blood flow is changing as we age, and it can cause some of those symptoms. And those are all things that we address naturally at Western New York Pain Relief with advanced regenerative therapies, no medications or surgery.
So there's no magic pill that's going to cure neuropathy?
I wish there was. No, there's no medication that actually treats neuropathy. Anybody that's listening right now, if you've gone and seen your doctor and you don't ask them what medication they're giving you, what it's for, and what the side effects are, you need to advocate for yourself. Gabapentin is an anti-seizure medication. They tell people it's for pain. It's not. Lyrica and Cymbalta are antidepressants. They tell them it's for pain. It's not. So if you're on one of those medications and you've questioned why you're not getting true symptom relief and why you feel weird, like you're having memory issues or you're sleepy or groggy or moody, that's why. And a lot of people are taking medications that they shouldn't be on because there is nothing to treat specific disorders related to the musculoskeletal system.
Let's talk about chronic pain for a second. And I think you were telling me before that chronic pain can sometimes develop into new pain?
Yeah, chronic pain is one of the most notorious factors in how a person ages and how inflammation is produced. In a clinical study, they found that individuals over the course of 10 years that had inflammation that was left untreated developed other comorbid conditions like high blood pressure, cholesterol, and diabetes, and further nerve and joint issues. So if you kind of think about it, if you have an issue with your knees, what's going to happen if you don't take care of your knees? You're going to have a problem with your hips, you're going to have a problem with your back, you're going to have a problem with standing and walking. If you have a problem with your back that you leave untreated for a period of time, think about how it's built up over time. All of a sudden now you have this chronic pain that's not going away, you're losing function in one of your legs or both, you're getting sciatica, and it's affecting everything. And we have to understand as we get older, we're developing more issues and we're having a harder time healing them, okay? So it's really important to take care of these things and have them properly assessed. But many times people get referred for things they don't need. You know, you might try some physical therapy or chiropractic. You might have an injection, but what happens when this stuff doesn't work? They're leading right towards surgical intervention, which could be unsafe or not work and have negative side effects, when there are forms of regenerative therapy like what we do. And when patients come to us, I just had an 86-year-old with a previous fusion in their back, and he couldn't feel his legs or feet. He's now to the point where he can feel his legs and feet, he can stand and walk, his balance is restored, and his back pain is gone. So if people tell you age is a number, laugh at that. It's not true. Everybody can heal. You just have to get the right stuff.
You know, and you can kind of flip the script sometimes on some of these things that are going on. They can come to you and they can say, you know what, back surgery is the thing that I hear. People say, oh, don't do back surgery unless it's a last resort, right, or whatever.
Of course.
And you know, they can come into you, and we've talked about this before. We only have a couple of minutes left, but we've talked about this before, how everything is interconnected.
Yes.
It's not just, you know, the knee hurts, so it's got to be something with the knee,
yes.
or my ankle hurts. It's got to be, you know, it's the whole body is intertwined, right?
Yes, and we bring customized treatments to the patient specific for their needs. So if you have a problem with your back and it's affecting your knee or your foot, I'm going to treat your back, I'm going to treat your knee, and I'm going to treat your foot. We have knee decompression to help people avoid knee replacements or injections. We have spinal decompression to help people avoid back surgery or treat a disc or a nerve disorder that couldn't be treated. And we can treat neuropathy of any kind. We use a combination of therapies that regenerate tissue, accelerate healing, eliminate inflammation and pain, and restore quality of life in a very short period of time.
Dr. Christian Miliotto, Western New York Pain Relief, thanks for joining us today.
Pleasure as always.
For more information and answers to your questions, contact Western New York Pain Relief by calling 716-650-PAIN or go to buffalopainrelief.com. Sponsorship and promotional consideration for the preceding segment was provided by Western New York Pain Relief. And join me weekday morning, 7 to 9 a.m. on Buffalo's oldie station, The Big Whack.